Reporting there is a lag in that data because of the backlog in analyzing the test kits.
And that can make it difficult for doctors and medical experts to gauge just where the Houston area stands in the pandemic.
Brandon Walker is live at the University of Houston tonight with a closer look at these efforts. Brandon?
Yeah, Chris, a bit of a head spinner because you've got lots of numbers that correspond to rates. You just talked about those positivity rates, but there's also the infection rate, there's ICU bed capacity rate, also the mortality rate. Doctors tell me that they're using an option E, all of the above approach, and attempting to gauge what the coronavirus means for the Houston area. So that did take us, in fact, here to the University of Houston and their College of Medicine, where we got a lesson today from the chair of the clinical science department on how much of a struggle it is for doctors to gauge this. Why is it so hard? That was our first question, and that's where we start tonight.
It's moving so quickly.
Dr. Brian Reed says thus is the challenge for doctors working to understand for a fact coronavirus's footprint on the Houston area.
We had things under pretty good control back in March and April. We didn't have as much community spread at that time.
Today, we need to flatten the curve again.
Today, yet another call to control that spread, which doctors gauge by several variables, among them the positivity rate.
Individuals testing positive for a particular disease, but we need more time to sort of analyze that data to determine the true infection rate.
Which is tough because while more people are being tested, an infection rate or the percentage of people within a community who have COVID-19 hasn't been easy to define, in part because community spread has been so quick.
Things are too dynamic. I mean, we've gone from, hardly any sort of activity in the community to, now we're having greater than 1,000 cases a day in the Houston area.
That segues to hospitals and daily charts and data published by the Texas Medical Center. An important marker, general and ICU bed capacity.
So they tell us that we have more and more individuals that are, becoming sick or ill with severe symptoms.
Yeah, and as I told you last night when we focused on the mortality rate, advancements in treatment at the ICU level in terms of what we now know about this virus, what doctors know, has affected the mortality rate in that it is lower. But officials say that that's not reason to keep your guard down. Also with the ICUs, the percentage of those who are COVID-19 patients, about a third. And so some have written into the newsroom saying that that's a low percentage. So what are doctors talking about? But to that, Dr. Reed says that's not a low percentage because that's a third of the ICU capacity dedicated to COVID-19, and that means as that continues to increase, specialized doctors will have to focus solely on COVID-19, which means other elective care, other things that they're trained to do, they won't be able to, which means others are going to be missing out on the care they need, which speaks to the importance of doing what you need to do to control that spread. Live tonight on the University of Houston's campus, Southeast Houston, Brandon Walker, KPRC Channel 2 News.
Okay, Brandon, thank you.